Okay, well, welcome everyone. This is the P-Seat panel to discuss the budget process of San Francisco and lessons learned from 3 panelists that we have joining us today. We are recording this meeting so that we have the ability to share it out afterwards for folks that aren't able to attend. But we're super excited to bring the experiences of these 3 folks on the screen. So the way that today will work is that we'll read introductions for these folks, and then we will hear from our panelists who will speak for about 10 minutes each. And then we will share some lessons learned from the presentations, and then we'll open it up for a group Q&A at the end. So if you do have questions, feel free to write them down, or you can even pop them in the chat for later and we can cruise back through that. But should be super exciting. So I'm going to pass it to my co-chair. My name is Blythe Young. I'm the Community Advocacy Director for the Heart Association, also the co-chair for P-Seat for Shape Up, which is Policy Systems Environment Action Team. And I co-chaired this committee with Chris Chow, and I will hand it over to him to introduce himself and introduce our panelists.
Great, thanks, Blythe. My name is Chris Chow, as Blythe said, and I am the Acting Project Director for the NEOP program at the SS Health Department. So I'm really excited to introduce our panelists today. These community advocates have successfully advocated for nearly $2.5 million over 2 years for the city addback process. I'll start with Jennifer Navarro-Marquin. She is the co-founder of the Community Well Shape Up SS Coalition co-chair and has over 15 years of experience as a business owner. She currently has a prosperity coaching and financial services business and weaves both financial education and holistic arts together to help individuals return to their natural state of happiness and fulfillment. John McCormick is the program manager of TNDC Healthy Retail and has been a part of the TNDC family since 2006. He started TNDC as a volunteer in the Tenderloin Garden and became the manager of Healthy Retail in 2020. Before his time at TNDC, John spent a decade working in restaurants as a cook, waiter, and a busboy. John holds a bachelor's degree in international studies and a master's degree in nonprofit administration. And then lastly, we have Naima Charles. She is the director of the Public Policy Communications for Children's Council of San Francisco since 2020. Naima is a political veteran with experience in public policy, speaking, grassroots organizing, and issue-based campaigns. So thank you to Jennifer, John, and Naima for joining us today and sharing your stories, outcomes, and lessons learned to demystify the city addback process. All right, so before we jump in, I want to start with a land acknowledgement. So feel free to use this link to share what land you're currently on in the chat, along with your name, your pronouns, and your organization. All right. So I'm gonna keep going in the interest of time. So if you're new to Shape Up, next slide, please. All right. Okay, so keep adding on to the chat while I go through the next slide. So if you're new to Shape Up as a coalition, our mission is to advance health equity in SF by collaborating with community partners on systems changes that increase nutrition security and active living. So we do so through 3 key strategies: mission-aligned partners for collective impact, learning, and networking; stakeholder capacity building to address health equity and upstream risk factors for chronic disease prevention; and then policy systems environmental change strategies. Today's Lunch and Learn is a project of Shape Up SS P-Seat, which again, Blythe and I co. So let's jump right in. Each of our panelists will take about 10 minutes to share their story. Then we'll open it up for Q&A and then wrap up. Well, we're actually going to do a little bit of a lessons learned and then do a Q&A afterwards. All right, so let's jump in. We're gonna go ahead, I'm gonna send it over to Naima first, I believe. All right.
I think we're going to Jennifer first.
Oh, okay, great. To Jennifer, thanks.
Thank you, Chris. Thank you, Blythe. Happy to be here to share a little bit of our experience. And I think this is such an important conversation. So thank you, Shape Up. Thank you, P-Seat, for convening us in this way, because I think there's so much we can learn from each other. And just for full transparency, I am not an expert in this. I know I've read Naima's bio, I've read John's bio. I think that they are, much more well-versed in this process than I. And Community Well, we're a small organization. Our annual operational budget, and I'm going to be fully transparent, is underneath 400,000. So we are a small organization. And for those of you who are in our category as well, and even those of you who are not in our category, hopefully what I share can be something that is a discussion point for all of us. So I'm going to share two experiences that our organization had in the last budget season. We did do some great work around mental health, and also we did some advocacy and addback asks for our own personal organization as far as fulfilling a role for us that would help our organization as far as impact, and then also as far as just stability within our organization. So just so that you know, we did not have a blueprint, or we did not have a model. We kind of fell as we went and did the best that we could with the resources and the support and the advice that we had. So I'm going to share my screen, and I'm just going to kind of share the process that we went through for the first kind of, campaign, or the first area of focus, which was a collaborative focus. And this was, it did go into the mayor's budget initially, and then it came back in the add back. So I think it's relevant to this conversation. So myself, and I believe I saw Miss Felicia is on the line. We were part of a collaborative initiative to really bring attention to the Southern Eastern neighborhoods and our needs for resources, and really changing and disrupting our mental health system in the Southern Eastern neighborhoods of San Francisco. So we did have some support from the supervisor's office to start convening all of our stakeholders. And that's what we did. We started convening stakeholders, hearing from those on the front lines and on the ground, and really addressing all of these huge needs and priorities every single day. So there were social workers and teachers and CBO workers that were leaders in our communities that were part of this conversation. And it really went and ran through November 2021 to June 2022. So in our whole process, this was the scope of our impact in really bringing forth a beautiful proposal for changing the landscape, and not just putting a Band-Aid on mental health, but really looking at it as disrupting the system, right? Because something, as we know, had to change, and it was extra compounded crisis after the pandemic and into our pandemic recovery phase. So in our proposal, these were the populations that were highlighted. These were the services that we were really pushing to be provided. These were all on the side here, on the right side of the screen, were all of the participating D11 stakeholders. So it was really wonderful for us to come together and have these conversations, because it was something that was not happening. And I think that was a beautiful thing, that the pandemic really opened these doors and created a more collaborative process and network for us. So in our initial mayor's budget request, this was the whole, and this is, this number 6 million and some odd was really addressing a huge landscape around mental health. It was really addressing it in schools, addressing it with CBOs and residents. It was addressing it in ways where we were creating a pathway for, especially in our communities of color, to have providers that looked and were supportive of their community. So it was a big scope and umbrella of work, and there was a process to this. I kind of wanted to share that, really it was going through this whole process here and really looking at this new framework from addressing mental health from a priorities perspective, also in a dignified mental health model, creating low access or low barriers to accessing mental health in a culturally supportive way in our communities. And really, I think this is a big thing, is creating a pipeline for mental health providers to be able to work and live in the communities that they want to work with and live in. So these were some of the situations that I already kind of shared with you here. So situation priorities, we had our convening members, over 30 of D11 mental health service stakeholders participated in this process. This is a list of those organizations and leaders. And really this proposed mental health model, which I really did kind of go over a little bit, it went through a convening process from probably really thinking about this November 18, 2021 to about February 17th. That was when we did our big thinking and we did our big surveying and we did our big research. And what we're really coming up with were these solutions for these 4 quadrants of really looking and addressing at mental health in different ways. So this was the proposed impact here for that funding initially that went into the mayor's budget. And it was really looked at annually. This would be our impact and our reach for this funding. So D11 schools, 1,300 students, 628 student and families, working with CBOs, free services. It was really brought up that seniors, level 2 workers were a high need. So 450 of those were what we estimated as well, and really cultivating this mental health pathway, about 520 youth with the participating schools. So over in the last, I think this is the important little column, is the timeline. So moving from November, December into January, where we did a lot of our work, into March, and really looking at the advocacy and really pushing on this really started to happen in March. We got the word that, hey, this isn't going to go in the mayor's budget. That was in about April, I would say. And the reason for that was that they didn't want to fund anything new. And another reason for it was that, for that amount, it needs to be citywide. It cannot be location based. So that was the answer we got. So what came back, working with the supervisor's office, is let's try to get something, the bare minimum, to make something happen, in this whole dreaming and revisioning and reimagining what could be the bare minimum to start this process. And what was put into the addback budgeting for the supervisors was $100,000 to fund one mental health coordinator that could work with the schools, that could work with the CBOs, that can work with the leaders, so that they can be a resource and a safety net, so they can plug into some of the resources that were already existing in the community. So that went into the supervisor's budget, and they went through their hearing, and it was awarded. The $100,000 was awarded, so that it's specifically for the southern eastern neighborhoods of San Francisco to have this coordinator be that first step. So that was this process. And I have to say that, is it a win? It's a start. Let's just say it's a start. So that was the mental health process that we went through. And I think the win is that we were able to come together as a southern eastern neighborhood mental health provider and learn more about each other and create deeper relationships. I think that was the huge win. So the second ask that we went into, which went into the addback budget for our supervisor, was a request for us specifically for Community Well. So it was for funding a part-time community engagement manager. We are a small staff, and we realize that we need support in order for us to have a stronger capacity and a sustainable capacity. So we submitted in that this partnership, this individual would be in charge of supporting our partnerships that are existing and even creating new ones and fostering and strengthening them, really outreaching, engaging with community so that they know what services that we're providing, and maybe even working with that coordinator closely. So we have a really a great way of getting people accessible to our services, and then also really having a support in supporting donor relationships, because that is that second leg that's going to bring strong stability to an organization. So they would have this big scope of work. What was submitted in for the budget request actually was not part-time, it was full-time. And what came back and was approved was 28,000. That was and we're still right now, we're solidifying the process of getting paid that funding for this request. So this is an immediate need, and short-term to mid-term funding is what we talked to the supervisor's office about. And for this took us meeting with the aide and talking them through, providing our thoughts, our presentation, her speaking to the supervisor, and really working with, I think Supervisor Ronan was the one that was in charge with the addback budget process. So working with their office as well. So I'm going to stop right there because I think I'm at 10 minutes, and I'm sorry if I went a little over, but I'm also going to include some links in the chat if you wanted to look at some supportive documents that we submitted with our asks. Thank you.
Thank you, Jennifer. I think next so if you have any questions that came up for Jennifer's presentation, feel free to put them in the chat and we will save them for Q&A. But now we're going to move over to TNDC, and I will let John introduce his team.
Hi, everybody. Thank you for having us. My name is John McCormick. I'm the program manager for TNDC Healthy Retail, and I'm joined by Tammy and Jalal, who are both food justice leaders here with our community, with TNDC, but they're also really important community members who made our addback process happen. And so I wanted to include them on the process of the presentation. And we're going to talk about our addback process from 2020, when we were advocating for the community to receive hot meals when folks were sheltered in place and they weren't able to, it was dangerous for people in the Tenderloin to move outside of their homes. So Tammy, do you want to talk a little bit about the seniors?
Yes. Hi, everyone. Hi, everyone. Good afternoon. My name is Tammy. I am the food data leader and also I'm the food distribution also for the TNDC community organization. Today, I was talking about some senior is not communal works. It's not communal work. So we need to help deliver the food to them and we speak about a meeting with the supervisor to tell about why the senior need for the hot meal. Thank you.
Thanks, Tammy. And Joel, did you want to talk a little bit as well, just about like folks not being able to get out and access food during the pandemic?
Yeah. My name is Jalal. My background is I'm a doctor. So I know what this is situation in my experience as a doctor. It was people who was in our community elderly and sick, as mostly people has chronic disease, they cannot move, and they afraid to catch COVID-19, and they afraid to be catch 19 and to get sick or something happen. It's helpful what we did as we bring hot meal at the door and help him to go to outside. It's very helpful for these people, elderly and who has a disease. Thank you.
Thanks, Joel. Thanks, Tammy.
Welcome.
So yeah, during the shelter-in-place portion, like Joel and Tammy just explained, there's, the Tenderloin has the highest concentration of people with disabilities and the second highest density of seniors in the entire city. So there was a real need from the neighborhood to come up with a response to make sure that people got hot meals delivered to them. As Jalal said, it's folks are immune compromised and it's not safe to go outside at this time. So there was a coalition of folks in the Tenderloin that came together that saw this need and decided that we needed to try to get some hot meals into people's hands. And so TNEC worked with Farming Hope, La Cocina, and Jennifer, shout out to your great presentation. Like we don't have anything that well put together, but you had all the community partners listed there. We probably have a similarly long list of folks that we worked with that really helped advocate to get these hot meals to folks in the Tenderloin. So our process really looked like the first thing we did was we joined the Budget Justice Coalition. After we had our group together, we joined the Budget Justice Coalition. If you don't know the Budget Justice Coalition, they're a group, they're run, it's like an incredible group of people all fighting for addback funding, but doing it together so that there isn't this competition process over achieving or getting funding. We're advocating together for funding, and we're learning about the process, the budget process within that process. And so I had never done any budget work before this, and I don't know if anybody else, I don't know if Tammy had either or Jalal had either. Our team, I think this was our first time, and so joining that coalition really helped us get our feet on the ground and help understand the process. After we did that, we really got the community involved. Folks like Jalal and Tammy and other folks from the Kroc Center came together, and we went to supervisor meetings or we went to meetings with supervisors, and we really spoke about the importance of having these hot meals into people's hands. And folks like Jalal and folks like Tammy, who really need folks that are seniors and folks that were people with disabilities, people that lived in the neighborhood, came to these meetings and spoke out about why it was really important that these meals get into their hands. And I think that that's like a really important part to this process, is that the supervisors and their aides were able to hear directly from the community and able to hear directly from the people most affected. And I think that really helped out the process and in achieving the funding that we got. And it wasn't just that they were there to talk about what the need was. Like, the folks that were part of the community were involved in the entire process of speaking about how this is an issue and why this was an issue. The community was involved in the entire process, including now when we're speaking about it, years later. And I think that is really important, that we're, in these sorts of processes, that we're uplifting the voices of the folks that we don't normally hear from enough. And I believe that it was a reason that we were successful as well in achieving our funding. So we initially applied for $150,000 in funding, and we ended up getting funded for 2 years with $300,000, which was a surprise to us. We didn't expect that funding. We got more than we wanted, and so that was a big deal. Another really big thing within the process that made us successful is that we had a champion for our work in Matt Haney's office. His former supervisor, now state assemblyman, Matt Haney's legislative aide, Courtney McDonald, was instrumental in making sure that this funding got into our hands. And she did a lot of work behind the scenes to make sure that the community was fed. And I don't think that we have the same success if we don't have someone that's behind the scenes working, at the supervisor's side in the city hall, working to make sure that this happened. And so that was super, super important. The addback process is an interesting process. It's not an easy process, I would say. But it's informative. There's a lot to learn. And one of the learning points that we had was, we got the funding in July, or sorry, we didn't get the funding in July. The addback process, talks about, you get the paper or whatever, says you get funded. It happened in July of 2020. And we actually didn't see the funding come through until much later on. I think it was like January of 2021. And that was an issue that we want to navigate better next time. And the reason that that happened was because we didn't identify early on a department that the money needs to go through. So like the money can't just, there's, the city process is very bureaucratic, and they needed to identify the right location for the money to be given back to the nonprofits, TNDC, so that we could get it out with Farming Hope in La Cocina to get the meals out. So I just want to emphasize that like identifying a department ahead of time is really important so that the money can go straight back out to the community and into the nonprofit's hands. Yeah, do you guys want to add anything else?
Yeah, I think that's what's happened. It was very helpful for our community. That's what's happened. It was for our experience for future, for our life or job. And for our community, it was very close contact and helpful for people who need the help. So we support people who has right people who need that. We need that. We thankful for people who working with this, with support us to do that. Yeah, thank you.
So I hope that this one it will be successful. It's really kind of seeing more people they need help. So thank you.
Thanks. I think that's all we have. So yeah, thank you for the time, and thanks to everyone who came out on their lunch to listen to this presentation. So okay, thank you.
Thank you, TNDC. We have some questions coming to the chat, but we're going to save those for the end. So feel free to stick around. And next we will go to Naima Charles from Children's Council.
Hi, everyone. It's nice to see you all and meet you all. My name again is Naima. I currently serve as the Senior Director of Public Policy at Children's Council of San Francisco. We're an organization that connects families to childcare, trains new childcare providers to go into the field. We have a childcare provider shortage, and supports the needs of existing childcare providers. So hopefully they have the support and compensation necessary to stay working in San Francisco. So my role specifically, though, is to ensure our local, state, and federal representatives stay up to date with what is going on in San Francisco regarding childcare and other needs for families with young children, primarily 0 to 5, although we do go up to 0 to 8. And I also work with the Child Care Planning and Advisory Council. We call it CPAC. I'm the Policy and Legislation Chair there. And I'm one of the lead organizers for the San Francisco Early Care and Education Advocacy Coalition. Early care and education, another way of saying child care. And so basically, long story short, I am highly involved and interested in childcare and improving childcare for San Francisco families. And I try to do as much as I can to do that. And I don't even have any children. I'm just really interested in the cause. And so one of the things that I really enjoy about advocacy and that I use in this ask that I'll talk about later is consensus building. The two coalition groups that I work with bring together any child care advocate from across the city. So they all have different things that they want to prioritize. Of course, they all have interests that they need for their specific businesses. And so one of the things that I really enjoy doing is bring everyone together, figuring out what is like 1 to 3 things we can actually agree on and work together, because childcare is a very, it's a big issue, but in SF, the voice is not as big as, let's say, K to 12. So if you're talking about educational funding, a lot of the time that money will go there, although a lot of Black, Latino, and Pacific Islander children are starting kindergarten far behind their peers, so it starts earlier. But that's an educational component that we're all working on. So I actually have some slides in the deck. I can share my screen right now. Or if you, yeah, it's perfect. So can you actually go to the next slide? I just rearranged them. Sorry about that. Thank you so much. So I'm going to jump into our kind of advocacy journey that we did. So first, what we were advocating for is our child and adult care food program. So what is that? Child care providers that operate in San Francisco, are honestly anywhere in the United States, they are legally required to provide 2 meals and a snack to children. And they have to provide this themselves. The cost per year to take care of an infant or toddler is anywhere from $40,000 to $50,000 per child. So it's extremely expensive because these kids cannot be left alone for even 30 minutes. They're babies. So it's a lot of labor intensive. It requires a lot of staff, et cetera. Very expensive to run. So something that the federal government did was, okay, you're already losing money. We can at least give you a small reimbursement rate per meal. That reimbursement rate was around 50 cents per meal. In COVID, it increased to these rates here. Tier 1 and Tier 2, I'm not going to get into, but basically, if you're a Tier 1 site, you're serving more low-income children than Tier 2. But also during COVID, the federal government made all reimbursement rates the same. So this is the current reimbursement rate per meal. Childcare providers are still losing money. So our ask to the local government was, can you provide a gap funding, additional funding per meal to help it be closer to the real cost of providing food in San Francisco? And so that's what we were advocating for this past year. And so the first thing that I have to do is get people to care. This program is a food program, but is administered by childcare. So it didn't really have a place. Food advocates have so many priorities. It was one of them, but it didn't have a clear focus. And honestly, childcare advocates didn't want to touch it at all. They're like, we're not in the food business. This is not us. So my advocacy actually began a 1.5 years ago, where I had someone from our food program come and present to this group of advocates, childcare advocates that I bring together. And basically they explained the program, talk people through why this was actually under childcare, and try to gain interest. At that time, was not successful. People were still like, oh, I don't want to touch that. HSA can handle it. But fast forward to longer in COVID, we see here now 25% of children in SF are going to bed hungry. And so that number was growing, especially for 0 to 5 children. So we were finally able to get the momentum to get the childcare community to sign on to want to prioritize this food ask. So that was step 1. Next, once we decided that we wanted to make this our primary ask for the addback, which is the same program that the other 2 panelists have participated in our budget process, we had to develop a policy proposal. So this was an interesting year because, the addback, basically the money comes from the departments make their budgets and it costs X amount. Then the controller goes through each department budget and starts redlining things. We're not funding this, you're overfunded this, and that creates this addback pot of money. So once we found out how much money was in the overall addback, we were able to figure out, get a sense of how much did we want to ask for. And so we had to, if we can go to my other slide, please. Sorry, go back. So we developed we started doing research, and we had a great study on young children and food that was, I think, done in partnership with Shape Up and other food organizations by a woman named Libby. And that had a lot of informative data. And we also did a survey with the childcare providers that currently participate in the program to better understand exactly how much money they were losing. And so with that, we decided that it would be great if the city of SF gave us $1 million so we could increase how much money providers were getting per meal, like I was talking about earlier. And so what we always do whenever we have a budget ask is we put it together in a cute little policy proposal, which you can kind of see here on the left, which goes over some background information, on the ask, why it's important, and then we provide a little bit of data, not too much, about how many people it would serve and what the impact would be. So we do this every year, regardless if it's a local or a state ask. So after we developed a policy proposal, I went to the childcare community and got key organizations to sign on. You see some of their logos at the top of that letter draft there. And we also, as John mentioned, are a member of the Budget Justice Coalition. And I just want to reiterate that that's really a great group because our city budget is around $14 billion. These false narratives that you can only fund mental health, and if you do that, you can't fund childcare, is false. There is a way for the city to figure out a way to fund everything. So we really value that coalition work. So we developed our proposals early. I think they were done by around January. And then we began meeting with every board of supervisor and mayor to talk through our childcare asks. These were primarily over Zoom. But a huge part of it was first half the presentation was just educating people on this program. Nobody had known about it. So we had this whole educational component to people can understand this complex federal program. And then we had to then explain why we needed city funding. So, so that was really the mix in it. And we continued to follow up with our supervisors. And come June, that's when the June kind of hustle starts. And we were able to be pretty aggressive. We were at City Hall maybe 3 or 4 days a week, every week in June, just constantly just bothering and being annoying to all the board of supervisors and the mayor staff whenever you can catch them walking in the hall, which is rare. And we really just wanted to make it known that the childcare community is here physically, and we really need these city dollars. We're here almost every day. So we did that, and that was pretty successful. Come the big budget day, which is where that how the addback money is spent is finalized. We started off the day with them allocating $750,000 to us. Not quite what we wanted, or I think it was like 800,000, sorry. Not quite what we wanted. We wanted $1 million, but we were, fine. This was a tough addback year, that will work. Then as city politics happens halfway through the day, our entire ask got cut from the addback. We now had $0. We had to figure out what had happened. We have our champion supervisor, I think John had mentioned how at the time Haney was his. It's really important to try to find one person who will be your champion. Ours is Supervisor Melgar. So we ran to Supervisor Melgar's office. We're like, what happened to our money? She helped us get it back in. And they wanted to only give us $500,000. And so at that point, we had to tell them that, no, you need to give us the full $1 million, and that this is the least you can do. And I know some of you are probably thinking, wow, that's kind of rude, or wow, that's kind of bold. But I think the reality of it is I'm not advocating for myself, right? We're advocating for community, we're advocating for food, and we're advocating for children to not go to bed hungry. So it's really easy to be aggressive because all of us were advocating for really important things. And I was like, we wavered on some other budget things, which I won't get into now. You need to do the full amount. And so, we got the full $1 million, which was more than we originally started with and we're okay with initially. And I think the reason that worked is because we show up united. We're a small group, but we try to bring everyone together and figure out what are the 3 things we can really be intentional about advocating for. And I think another thing too is they saw us. I think people are still in the time of Zoom and they don't realize that City Hall is fully open. So I think that was one of the ways that we were able to really stand out. But yeah, that concludes my presentation. Thanks, everyone.
Thank you so much, Naima. And thank you to all of our panelists, definitely a group of fierce advocates who secured over $2.5 million for their causes, which is remarkable because I think, we hear the city budget and we think that that amount of money is impossible, but it is possible. And so Marianne's going to put up a slide that has lessons learned that we gleaned in our preparation for this panel, talking to all of our great speakers. And so we compiled these together, and we can send this out afterwards as well. But a few of the things we learned are the difference between the mayor's budget and the addback. If you can't get into the mayor's budget, then go for the addback dollars. I think due to the time delay of receiving funding, we heard that it's best to view the addback dollars as an augmenting source of fund. Or if you can do that, if you can be applying for other funds as well, or use them to expand a strategy you're currently working on and funded to do, that's a great way to sort of deal with the time delay that can happen. And then early in the process, identify a department that will distribute the funds. So if you go in and you have a plan of, a champion on staff that you're working with in a supervisor's office, and you can work with them to identify the best department for the funding to be allocated to, it saves a lot of legwork for the city and a lot of time in terms of them trying to figure out which is the best department or which department has the capacity to house distributing the funds. In terms of timeline, in the fall, most folks met with supervisors to explain the issue and sort of gain general support for their causes. In the winter, advocating to be included in the mayor's budget. In the spring, making specific asks for supervisors with their offices for addback dollars, or to support your mayoral budget ask. And then in May and June, really going full tilt with advocacy. So most folks ended up working in a coalition with other stakeholders. Budget Justice Coalition sounds like a great place to start if you're looking to go for funds in the future. But there are a few things that make up a great coalition in terms of advocating for a budget item. Again, identifying a supervisor's aide to be your champion, someone who really cares about this issue and can help shepherd you through the process. And then creating a coalition super team. So you need someone who can lobby and advocate for funds, because a lot of folks are education only, where they can't actually make the ask at the end of the day. So find someone, like Naima or like the Heart Association or other folks that aren't constricted by funds that can help push your ask over the line. And then find someone with budget experience, maybe, talk to someone who's been here before, or, attend a panel like this where you can hear generally sort of how things went for folks and glean lessons learned. And then, ideally, you could also find someone who has influence on decision makers. So someone that they, have an ear of a decision maker, and maybe they've worked with them before. So you also want to organize public comment, have like 10 key points and choose 2 to 3 to highlight and distribute that to your coalition for folks that are able to give public comment. And then engage the community in the entire process. Thank you so much, John, for bringing community members to your team today to talk about the process. And then getting sign-ons from other organizations or other coalitions that work on similar issues. So that's sort of the high level, what we learned from all of our speakers in the prep that we think holds true. And we ran it past the speakers in terms of, whether or not they agree with those things. And it seems to be consensus that these things are key points. So we can move into Q&A. Marianne, if you want to, you could, yeah, there we go. And so I know, Jenna, you had a question about addback and the 2-year process in the chat. Feel free to come off mute.
Yeah, just that John had mentioned that they got 2 years of funding, and I just wanted clarity on that, because I didn't know if with addback funds it's different than with the mayor's budget, which they propose a 2-year budget each year, but it's actually really a 1 year because they change it every year. It's sort of a confusing thing, but I didn't know if the addback process was different.
Thanks, Jenna, for the question. Like Jennifer, I wouldn't say that. I mean, Jennifer, I think that Jennifer is an expert, but like I wouldn't say that I'm an expert in how this works. I don't like when we got the funding, it was like, oh my gosh, we had it for 2 years and it's double what we asked for. I don't know how that works. Maybe someone else here does, but yeah, I mean, we ended up getting the funding for the next year afterwards as well. And so it did.
And you didn't have to advocate again for it.
We didn't have to advocate again.
Okay.
Yeah.
Great.
Right. Naima, I don't know if you have any insight on that. I know I learned the most for you in terms of process specific pieces, but I would imagine it's a game by game scenario.
Yeah, you can decide if you want your ask to be 1 year or 2 year. So, let's say you wanted like $1 million and they gave you 500,000 per 2 years. You can actually tell the board of supervisors, actually give me $1 million this year and 0 next year. And that could be a strategy, but then you have to be ready to do the advocacy all over again. But in theory, if they fund your ask for 2 years, in theory, it should become baseline in the budget and permanent. However, because we're about to be in a recession, that's not a guarantee. You may need to still check in with your supervisors, but in theory, that should happen.
Thanks, Naima. And I see Christina has her hand up.
That was exactly my question, Naima. It was this notion of if it's a 2 year ask and it's a 2 year budget, it automatically gets added into the baseline. But it sounds like that is not a hard and fast rule, maybe. So from what you're saying. So that was my question. It's a great panel. Thank you.
Thanks, Christina. Any other questions for the panelists? Feel free to raise your hand or come off mute.
Actually, just real quick along like this line of discussion, like we also checked in with Matt Haney's office the next year to make sure that the funding for the next year would be coming through. Like we didn't just, just because we saw it the first year and in the line items, we didn't assume that it was going to happen, like be a sure thing for the next year. Like we definitely did check in and just to make sure that, and then like I think that Courtney was communicating with us through the process as well, that like this is going to happen. So, but we didn't have to do any like extra advocacy. But we did check in.
Thanks. Yeah, I think continued communication, I think, is a strong theme across all three presentations, and that, having that champion or building a relationship with an office over time, whether you're coming in from Zoom or whether they're walking the halls, I think is super important.
I'll add one more thing is that I think it's helpful if y'all are thinking about doing the addback, but it doesn't necessarily, like, unless you have like you just have a relationship with your city department and they are ready to go, if you are successful with getting the money, it doesn't necessarily mean that your advocacy is over. Like for our $1 million ask for CACFP, that's under the Department of Early Childhood. And they're saying, before we send out the RFP, we want to do a study on the needs for SF families. So then we have to do advocacy just internally with the department to say, well, we need an estimated date of when the funds will go out. So also, after you secure the funding, check in and make sure there's not a random study like we found out that they want to do first or any things like that. Because sometimes departments don't want to take on a new program too, even if you want it.
Yeah, I think that's great advice, Naima. Yeah, just because a department is directed to do something doesn't mean they have to do it in a timely manner. So it's good to get some timelines on the books and get agreement, from folks that helped to support you along the way, that you have a projected date of being funded. And I see that Marianne dropped in the chat. So for more about TNDC's story and their collaboration with Farming Hope, Christina Gota did put together and help work on an interview with Jamie Stark from Farming Hope, who couldn't be here today, but he does describe his experience in the video on YouTube. And so that's another great resource for folks to check out for another angle on pursuing city funding. So I'd encourage folks to look at that resource. And then we can keep putting questions in the chat, but I did want to kick it over to Christina or Mary Ann to talk about soda tax, the RFP that's out in terms of community organizations being able to pursue that funding as well.
All right, my office mate comes in and out, so my mask comes on and off depending. I'm happy to speak to that. So we just released an RFP, a request for proposals for soda tax funds. Those are for organizations with budgets under $1.5 million. We do that so that their smaller organizations aren't competing with the really big nonprofit organizations. And there is another RFP that will come out next year for larger organizations where there's no budget limitations. So these there are 2 RFPs out right now. One is specifically for organizations serving public school students, and the other one is for serving priority populations. So we've had information sessions on both of those. The recordings and questions that were asked and answered are on the website, and we can add in. Thank you, Mary Ann, for putting the website into the chat. The proposals are due December 20th. And the grants are expected to be 3 years cycles, maybe extended depending on available funding and so forth. The first round of funded agencies were funded for 4 years. And so I think the other thing that I would say is the focus is to address diet sensitive chronic diseases. I think I'll leave it at that and see if there's any questions. Although we're not really supposed to be answering questions about the RFP because it has to be a fair process for everybody. And so if you have questions that aren't answered on the website, you can email questions in until December 9th. Having said that, there might be questions that seem reasonable for us to be able to answer. I don't know. Sorry, I'm giving mixed messages. I really shouldn't.
It's okay. Thank you, Christina. I think the important message that we want to get out there is that there is an opportunity for 3-year funding, and applications are due December 20th. So if you've ever considered applying for soda tax funds, this is your opportunity. And it's just another method through the city, to pursue funding, in addition to the advocacy process that we just outlaid in terms of the mayor's budget and add back dollars. So we have 5 minutes left. Sarah, I don't know, not to put you on the spot, but I don't know, is CBOT doing another round of grants in the coming year or anything to foreshadow?
What a good question. Maybe, maybe not. The capacity building action team of Shape Up gave out some mini grants this year, and we also did 2 workshops. We have one more coming up about boards of directors. If you've ever wanted to know anything about your board of directors, please join us on December 8th. Next year, we're going to be talking about this within Shape Up, whether we'll be doing mini grants or focusing more on those capacity building sessions and offering direct capacity building support to organizations and through the workshops we've been doing, but potentially also some other ways. So there will definitely be capacity building opportunities available next year for nonprofits in some shape or form.
Thank you, Sarah. So yeah, Shape Up has a variety of ways in which we can, provide as much information as we can or connect you and convene folks that are interested in a topic that you're working on. And CBOT is a wealth of resources in terms of capacity building, and they don't just do the mini grants, they do many other workshops. So encourage folks, if you've thought about capacity building beyond grants and funding, or even it was a yes and, to check out addback, who's our other action team for Shape Up. And if there aren't any more questions, we can wrap things up. Yes, PSEAT meets every month on the second Wednesday, 10 a.m. to 11 a.m. And our next meeting will be December 14th. So you can register at the link in the chat. We are a group that brings folks together that are working on policies and systems and environment, and we largely convene folks to discuss topics that are useful to them. So if you have a passion area or a project that you would like feedback on, or just to explore with folks, we're a great place for that. And then we do our own sort of budget and, issue advocacy through Shape Up. So we will be meeting in January to talk through our issue areas and to talk about what we would like to lift up to the supervisors. We generally lift up work that's going on in the coalition and help support that work. We don't tend to lead issue areas ourselves, but we do develop a policy agenda. And this past year that included nutrition security and included childhood obesity prevention, helping to support the STD TAC and soda tax funding in San Francisco, and then also complete streets. And so we've been able to do some great work with SFMTA and other departments in the city. But if you're interested in all, and maybe including some work that you're doing with your organization in PSEAT's advocacy for the coming cycle, look out for either the December meeting or the January meeting. And we'd love to have you as often as you'd like to come. No pressure to long-term commit, but feel free to pop in as it works for you. Marianne, anything Shape Up wise in the last minute?
No, I think this was a great session. I just want to say thank you to everybody for participating and all of our wonderful panelists. We are recording this session and we'll post it for those who weren't able to join us. But thank you so much.
And it looks like there is a brief question that will pop up when Marianne,
Yes.
it'll pop up in the browser.
Yes.
And that's our last thing of the day. So thank you, everybody. Feel free to fill out the survey. And thank you so much for coming.
Thank you.
Thank you.
Everybody.